We're back. So I don't recall if I've covered a Boston, Massachusetts company previously, but here we go. Today we have a company called FamilyWell, and it's a very kind of interesting niche space startup. So first of all, financial details. They raised $4.3 million in a seed round. That's a decent chunk of change for seed. It doesn't really tell us if they have product market fit yet. And it's so niche that it makes me wonder if there's any competitors here. So although in the healthcare space, which is the industry that this would be in, I'm thinking, although maybe it's software, there's lots of tools. So, but again, maybe this is so niche that this is an area that hasn't been looked at closely. And, in healthcare, people are always looking, especially insurance companies, always looking for an opportunity to save money, of course. So I think this can do that and offers that. So, it could definitely sell and, be of value to, patients and providers. So here we go. So from a solution perspective, what they do is they integrate mental health care into OB/GYN. I think that means obstetrician, so baby doctors, into those practices and leveraging technology. So, and from what I see from the website, it appears to me that it improves outcomes. More babies survive. That's the bottom line. Healthy babies survive. And that should really be everyone's goal. So it's a laudable goal. It's a niche. I would have thought that maybe, mental health care would be part of this, maybe driven by the patient separately, but I guess the value here is they're integrating it with, baby doctor practices. So, I mentioned that, not sure about product market fit, no clear indication of that. Competitors, kind of an open question because it's hard to say, what would be a direct competitor of this. Website is familywellhealth.com. I hope that's the right one. I think it is. As you can see in the image I'm sharing, this is exactly what they're talking about. They're talking about postpartum depression, pregnancy-related death, and, how many, 80% are preventable. So just wanted to highlight that. Okay, so what is the problem they are addressing? I kind of hinted at it. It's the segregated, non-integrated support for, OB/GYN practices. So they're integrating it, and apparently there seems to be some value to that, according to them. Who are their customers? Well, this shouldn't be a shock, but OB/GYN practices, those kinds of doctors. And from a VC perspective, they raised over $4 million in a seed round. It was led by, I think I got this right, 406 Ventures. Have no idea what that means. I don't know if it's credible, but anyway, that's the lead that I found. So total funding, I'm assuming there was some previous funding. I just didn't see any mention of it. So open question. I doubt they went straight into seed funding though. From a moat perspective, it'll be their patents around the software. You'll probably get sick of me saying patents, but that's really gonna be the moat. It's not like they have a hardware or design kind of thing they could patent or protect. Market size, it would be large if they could prove they could add value. So, the opportunity is there, but I see this with quite a few of these startups. Maybe if not most of them, that if they can prove they add value, the money will be there. in the healthcare sector, the insurance companies are the providers are going to be where the money's at. So again, prove the value, and the money you'll be swamped with money. So we'll have to see if they can do that. Additional thoughts? Yeah, healthcare is a good sector always to be in, but in the U.S., you might have seen news that babies are plunging. Like marriage is dropping dramatically. The number of births is dropping dramatically. We might have a demographic crisis at some point. So yeah, that's, they're stepping into a space that's shrinking, and generally I would have, concerns about that. But they're doing it. There's still, obviously tons of babies that are born in this country. So, and if it's proven, they could, license their software maybe, or sell it in other countries, and grow it that way. If the births aren't happening here, they're happening somewhere. So yeah, that's all I have for this one. FamilyWell. I wish the team luck.